Before I get back to your calls and your texts and your tweets on raising children and the stresses of it, the isolation that you can experience when you do it as well, I want to focus on some research that's been carried out by the Mile End Institute into the attitudes to taking the COVID vaccines that come. Here to talk about this with me is Sophie Harman, Professor of International Politics, specialising in global health at Queen Mary University in London. Good afternoon to you.
Good afternoon.
So this research looked into people or hesitancy from people about vaccines, both before and since the pandemic. What did you find?
Well, what's quite interesting around it is how likely people were to take the vaccine should it be discovered. And we were thinking that nearly a quarter of Londoners would not necessarily take the vaccine should it be available to them. But what was particularly revealing was among Black and minority ethnic people living in London, there was 39% of whom said that they were totally likely and 37% that said they were unlikely to take the vaccine. And this really stood out in comparison to white Londoners, for example. So it's a cause for concern that those sort of numbers suggest that vaccine hesitancy is alive and well among Londoners.
And were you just looking at attitudes in London, or did you get a wider national picture?
We were just looking at attitudes in London, but I don't think this is London specific. So vaccine hesitancy has been an issue in global health for years. I mean, even the World Health Organization said it was one of the biggest threats to global health. And that was back in 2019, before we even were talking about COVID-19. So it is a real issue, particularly in the response to COVID-19.
And that difference between 39% of Black, Asian minority ethnic respondents saying they were likely to have the vaccination, but 70% of white people. I mean, that's really stark, isn't it?
It's really stark, and it's a real cause for concern because, as we know, Black and minority ethnic people have been worse affected by COVID-19 in terms of death. So now we have the vaccine. You don't want to have this sort of double tragedy of low vaccine uptake among Black and minority ethnic people.
Did people say why they were hesitant, or did you just get yes or no?
This was just a yes or no. So it was a very quantitative study. But we do have explanations for vaccine hesitancy more generally. So we know that people will become hesitant around vaccines for a combination of rumour, where they get their news from, past discrimination and inequalities, perceptions of the vaccine, and also fundamentally trust. So trust in government and trust in health services. What's particularly interesting, though, in COVID-19 is the latest research on this suggests there's additional two factors. One is the speed in which the vaccines come about. So obviously, we're all very excited about that, but that does lead some people to ask questions, even though they absolutely shouldn't. I should say vaccines at the point in which they're available to us are safe. And the second one is, and this one's quite interesting, actually, because there are 3 vaccines that could potentially become available. Some people are questioning which vaccine is the best. So saying, well, I don't want that vaccine because it's going to go to low-income countries. Does that mean it's not as good? And of course, so these are all very interesting insights that just point to the fact that we can't dismiss hesitancy as some sort of crazy conspiracy. People have real reasons to question this. And that, again, is about the politics of the vaccine. It's not about the safety of the vaccine itself.
You're right that people feel they have real reasons and do have real reasons because of previous experiences and the like with healthcare systems and authority figures, authority bodies and everything. It's about drawing that line, isn't it, between hearing someone's fears and giving an anti-vaxxer airtime.
Yeah, absolutely. So it's understanding some of these kind of root causes, but of course, dismissing some of the more crazy aspects of vaccines. So it's sticking to the science and also the procedure in which vaccines have to go through before they're approved and then made available. But yeah, absolutely. I think there's a delicate balance to draw from, but vaccines aren't going to be successful if we don't really give people, we don't listen to these concerns.
I did a phone-in a good few months ago now where Black and minority ethnic women were telling me about their experiences of the health service. It began with their experiences of giving birth, of pregnancy and birth, but then it just broadened out into healthcare more generally. And many were saying that they were not seen and heard and listened to. Basically, that was their experience in the NHS. Are these two connected, do you think?
Yeah, I think so. Absolutely. I think So obviously, some of your listeners from that phone in will know that there was a study that showed that Black women in the UK were 5 times more likely to die from childbirth-related complications than white women, and that is an astonishing statistic. And was one that existed prior to COVID-19 again, but didn't really get that much coverage until COVID-19 really exposed some of these inequalities. And that really shows some of the systemic racism that exists in the healthcare sector. And I know we're quite queasy talking about this, especially during the pandemic and when people working in the health sector have been so fantastic. But that does exist. So when that exists, and then we're encouraging people to trust vaccines, these things come out. And I think it's something that definitely needs more attention.
Well, I'm sure everybody has got some kind of story from their healthcare where, if not themselves, then someone in their family. I mean, the number of female friends I've got who, when their children were very little, we're talking about the difficulties of raising children this hour, and when their children were very little, some doctors, clearly not all, treated them like fusspots rather than concerned new parents, and and had words like fusspot thrown at them.
Yeah, absolutely. And I think also, I'm 39 and all my friends are just coming to the end of, well, not coming to the end, but having children and all have their sort of pregnancy and childbirth related scare stories. But many of them didn't die. And I think that's a big difference. And that's, among my white friends as well. And I think, yes, there is a gender issue there as well about how women are treated in the health system. But again, the numbers don't lie. And I think this is also with COVID-19. So even a government report said that, death rates from Black and Asian people in the UK are higher than white people. Why is that? And people can sort of dismiss it in lots of different ways, but that is an issue of structural racism that we do need to consider.
Thank you very much, Sophie. Sophie Harman, Professor of International Politics, specialising in global health at Queen Mary University in London.